Wound care is the treatment of chronic wounds. We see wounds in all shapes and sizes, all body parts. What winds up typically in our wound center is wounds of the lower extremity for the most part. The most common types of wounds that are treated in the United States today are actually not diabetic wounds, although they're a very important cause of morbidity and mortality, and of limb loss and amputations and significant infections. But the most common type of wound is actually a venous stasis wound or a venous stasis ulcer that's caused simply by a progression of aging and of the blood vessels in the lower legs becoming incompetent. Some of the things that we can offer include the usage of things like the wound vac, which is the negative pressure wound healing system. We also use products to help the skin to close, such as bioengineered skin, the usage of collagen, the usage of wound matrix dressings that cause the skin to migrate over top of a wound and close. Of course, we also do use the hyperbaric chamber. We find that we oftentimes have to debride wounds and do some minor surgical procedures on the wounds to get them to the point where they're in a healthy state where they can then move forward toward closure. A patient will, generally speaking, be referred to our center, and about 15% of the time we'll find that hyperbaric oxygen treatment will benefit the wound. And we know that those types of wounds, for instance, that are positively impacted with the usage of the hyperbaric chamber include certain types of diabetic lower extremity wounds. We categorize these as Wagner stage 3 or stage 4 wound infections associated with diabetes. That means that the wound and infection have progressed down into the deep tissues involving tendon and or bone with or without the presence of gangrene. These types of wounds are benefited greatly by hyperbaric treatment. And then there are a number of other types of wound situations such as peripheral ischemia, loss of digits, failing flaps or grafts after a surgical procedure that will be greatly benefited by hyperbaric oxygen. What happens when the person is in this oxygen-rich environment, in this chamber, and again, that's not under the ocean, but it's right on the floor of our wound center. But when they're exposed to that level of oxygen, it forces oxygen in much greater concentrations into the tissue, into the serum, and into the wound, increasing the gradient between the pressure of oxygen in an oxygen-starved wound and now the patient's tissues, which aids in healing. As I said, there are two different types of chambers. There's the monoplace chamber that we use at Ogden Regional, and we have 5 of the largest type of chamber that's made anywhere in the world. It's called a Sigma Peri 40 chamber, and this is actually the largest chamber that's made. And because it's large, it's comfortable. It's comfortable for bigger people, and because it's large, it helps to mitigate against any claustrophobia that a person might experience, the fear of being in a close, tight space. Also, the chamber is 100% acrylic, so a person can look out, and actually our patients usually watch a television or DVD of their choice. I think that the future of wound care is very exciting in terms of some of the products that are being developed to help people's skin to close rapidly. And that's, of course, is our goal, is to get the person's wound healed as quickly as we possibly can, and then refer them back to their primary care physician. Most communities now are finding that a wound center, especially with the burgeoning amount of diabetes that we have in the country, is a very important part of good medical care in their community.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.